Hi, my name is Kristen and I'm a registered physiotherapist. This is a body mapping exercise for the hip and the lower leg. This exercise is designed to decrease tension around the hip, improve body awareness, and increase the efficiency and control of movement. It's important to move within your comfort zone, not pushing into pain, and to go slowly with calm breathing. You'll need a firm surface to lie on, something that you can feel the floor, but you're still comfortable. I'm using a yoga mat on my carpet. So begin by lying on your back. And as with any body mapping exercise, you want to take time just to notice the sensations in the body before and after the exercise. So start by lying flat. Noticing any tension that you might sense around your hips, your low back, your legs. Noticing the points of contact of your body against the floor. And noticing any differences between right and left sides. When you're ready, come to bending the legs. And you'll be moving, we'll start with the right leg. Moving the right leg out towards the side and then back in towards the center. Timing this with breathing. Breathe in, move the right leg out towards the side, and breathe out, move it back towards the center. Now spend some time finding your breath. Breathe in on the way out, breathe out on the way back in. Finding your breath and finding your comfortable range. You decide how far you would like to go. Breathing in as your knee falls out towards the side and breathing out as it comes back in. Once you're able to time your movement and breath and you found your comfortable range, then notice the quality of the movement. Breathing in as your knee falls out, breathing out as it comes back in. Noticing if the movement is choppy or rough, and if at all possible, try to smooth that out. Breathing in as the knee falls out, and breathing out as the knee comes back in. Trying to find a nice, smooth movement. Now, if you're able, notice the knee and how it moves through space. Thinking about the knee pointing to the ceiling and then noticing, does it move out 10 degrees, 20 degrees, 30 degrees, or 45, and bringing it back in. Breathing in as the knee moves out, noticing the angle changing at the hip, tracking the knee in your mind's eye. Does the knee move 10 degrees, 20 degrees, 30 degrees, 45, and then bringing it back in. You might need to slow things down a little bit more to notice the degree of movement. Then begin to notice the sensation around the hip. As your knee moves out and the hip opens slightly, and as it moves back in. All the while trying to make a smooth, controlled movement with your breath. Now noticing the sensations around your foot, how you roll to the outer edge of the foot, and then how you roll back in, planting the foot, sensing your footprint. Breathing in as your knee falls out, and breathing out as the knee comes back in. And then rest. Going on to the other side, moving the left leg now. Breathing in as the knee falls out, and breathing out as the knee comes back in. Find your comfortable range of movement and work at timing that with your breath. Breathing in as the knee falls out, And breathe out as the knee comes back in. Finding your comfortable range, timing that movement with your breathing, and then try to smooth things out, noticing the quality of the movement. If it's choppy or rough, trying to smooth that out a little bit. Breathing in as the knee falls out, and breathing out as the knee comes back in a nice smooth way. Now bring your awareness to your knee as it moves through space, noticing the degree of the angle as your knee moves in and out. The knees pointed to the ceiling and then moving out 10 degrees, 20 degrees, 30 degrees, or maybe even 45. Breathing in as the knee moves out 10 degrees, 20 degrees, 30 or 45, and breathing out as it rolls back in. Trying to see the knee moving through space in your mind's eye, sensing how much it's moving. Now bring your awareness to your hip, sensing any sensations around the hip as it opens up to the side and comes back towards the center. Just noticing what's feeling, what's going on there. And then noticing the foot, how you roll towards the outer edge of the foot. And then rolling back in as the knee points to the ceiling, the foot plants. Sense your footprint. Breathing in as the knee falls out. And breathing out as the knee falls back in. Feeling and sensing the foot as it rolls to the outer edge of the foot and then planting the foot. One more time. Then pause in the middle. Take a moment, straightening out your legs. Noticing any sensation in your body now. The points of contact, the tension that might be around the hips or the legs, and any differences between right and left sides. That might be enough for you today, and that's fine. That was part 1. If you'd like to go on to part 2, we'll be moving the legs through a bit more range. Starting with the right leg straight and the left knee can bend. Breathing in, let the hip roll out towards the side. And breathing out, let the hip roll back inward. Breathing in, rolling the leg out. And breathing out, rolling the leg back in. Try to find your comfortable range. Timing that movement with your breath. Breathing in as you roll your hip out. And breathing out as you roll it back in. Noticing your toes. How much they're moving through space as they point up towards the ceiling. And as they roll out, what degree are they rolling? 10 degrees, 20 degrees, or 30 degrees? And then rolling back in. See if you can sense how much your leg is rolling out and rolling back in. Knowing when your toes are pointed straight up to the ceiling and sensing as they roll outward what degree they roll outward to. Bring your awareness to any sensation that you have in your hip as your leg rolls out and as your leg rolls back in. Breathing in as the leg rolls out, noticing the sensations around the hip. And breathe out as your leg rolls back in, noticing the sensations again. Noticing the sensations around your heel, How you roll from the back of your heel to the side of your heel, or maybe even touching the outer edge of your foot to the floor. And as you roll the leg out, notice how the knee wants to bend. Sense what's going on at the knee as it wants to bend as your leg rolls out. So the next time you roll your leg out, allow the knee to bend, sliding the heel up slightly. And then breathe out, push through the heel and plant the knee so that the toes roll back in towards the ceiling. Breathe in, roll the leg outward towards the outer edge of the foot and slide the heel up, bending the knee. Breathe out, push through the heel, flattening the knee, and allow the foot to roll in, toes to ceiling. Breathe in, rolling the leg out and sliding the foot up. Breathe out, push through the heel, plant the knee and allow the toes to roll back in, foot points to the ceiling. Breathing in to roll out, bending the knee up. And breathing out, sliding the leg straight. Sensing what's going on at the hip and always moving with your comfort range. The next time you will lift up the leg, see if you can get the foot so that it's equal to the other foot. And then as you breathe out, plant the foot, bringing the knee in, knee points to ceiling. Breathe in, let the knee fall out to the side. Breathe out, slide along the outer edge of the foot, and then plant the knee, roll the foot in, toes point to ceiling. Breathe in, roll towards the outer edge of the foot, sliding the heel up. Breathe out, plant the foot, bringing the knee back in, hip rotates in, knee to ceiling. Breathe in, knee falls out. Breathe out, slide along the outer edge of the foot, plant the knee, foot rolls in, toes to ceiling. Breathe in, roll the foot out and slide the heel up. Breathe out, plant the foot, bring the leg back in. One more time. Breathe in, the leg falls out. Breathe out, push through the heel, slide the leg out, plant the knee, rolling the foot back in, toes to ceiling. Breathe in, foot rolls out, sliding the heel up. Breathe out, plant the foot, roll the hip in, knee to the ceiling. Take a moment just to rest. Then slide the left leg straight if you'd like to continue. Take a breath in and roll the left leg out towards the side. And breathe out, roll it back in so that the toes point to the ceiling. Take a moment to find your comfortable range here. Breathe in, rolling the foot out, and breathe out, rolling it back in. Breathe in, rolling the foot out, and breathe out, rolling the foot back in. Finding your comfortable range, and then trying to smooth it out. If you notice it's a little choppy or rough, trying to make it a little smoother. Breathing in as you roll your leg outward, and breathing out as you roll your leg inward. Now notice the degree to which you're moving, thinking about the toes, how they're moving through space, how the angle is changing. Noticing when they're at the ceiling, and as they roll to the side, do they move 10 degrees, 20 degrees, 30, or even 45? And then rolling it back in. Notice the toes as they move through space. Can you sense how much they're moving? Breathing in as you roll outwards, sensing the degree of movement. And breathe out as you roll back in, sensing that degree of movement through the toes. Now bringing your awareness to your hip. Noticing any sensations in your hip as your leg rolls outward and as your leg rolls inward. Noticing what's happening through the front of the hip or the back of the hip. Any sensations that arise, and back off if anything is unpleasant. Back off if you are having difficulty breathing through that. That's a sign that your body needs a break. Breathing in as the leg rolls out. Breathing out as it rolls back in. Noticing the sensations at the back of the heel, how you roll along the back of the heel to the outer edge of the foot. And noticing the sensations in the knee. Noticing how the knee would like to bend slightly as you roll towards the outer edge of the foot. And as you roll, allow the knee to bend slightly, sliding the heel up. And breathing out, push through the heel, sliding the knee straight, rolling the toes back in. Breathe in, roll the leg outward towards the outer edge of the foot and allow the knee to bend, sliding your heel upward towards the inner thigh. Breathe out, push through the heel, straightening the knee, plant the knee, and roll the foot in, toes point to ceiling. Breathe in, rolling towards the outer edge of the foot. Allow the knee to bend and heel slide upward. Breathe out, push through the heel, straightening the knee, plant the knee, and then roll the leg back in, toes to ceiling. Breathe in to roll outward and slide up along the outer edge of your foot. Breathe out, slide again along the outer edge of your foot, straightening the knee and plant the knee to roll the leg back in, toes point to ceiling. Breathe in to roll outward and slide up. And then breathe out, sliding the leg straight, roll back in. Breathe in, rolling the leg out. Try to get the foot so that it's beside the other foot. And then breathe out with the bent knee, plant the foot down and bring the knee in so knees are side by side. Breathe in, let the hip roll out towards the outer edge of the foot. Breathe out, slide along the outer edge of the foot, straightening the knee, plant the knee, and the leg rolls in, toes point to ceiling. Breathe in, roll the hip outward, and slide the heel up. Breathe out, plant the foot, rolling the hip in, knees point to ceiling. Breathe in, knee falls outward, landing on the outer edge of the foot. Breathe out, slide along the outer edge of the foot, straightening the knee, plant the knee, roll the leg back in, toes to ceiling. Breathe in, roll the leg outward and slide the heel up. Breathe out, roll the hip in, planting the foot, knees to ceiling. One more time. Breathe in, letting the knee fall out. Breathe out, sliding the leg straight, planting the knee, toes to ceiling. Breathe in, rolling out, sliding up. And breathe out, planting the foot, knees to ceiling. Good job. Now take a moment, straightening the legs. Noticing your body against the surface you're resting on. Noticing any tension in and around the hips or legs. Noticing your alignment or points of contact against the surface you're resting on. Noticing any differences between the right and left sides. And then noticing any sensations of just, in general, how you're feeling right now. When you're ready, you can work your way back up to sitting. The exercise is complete. My hope for you is that you feel a little bit less tension around the hips. You feel a bit more connected to them and able to control them. And that maybe you feel a little bit calmer after doing some nice slow movement and breathing. Thank you very much for practicing, and carry on.